Hi, I'm Andy Carter. I'm the President and CEO of the Hospital and Health System Association of Pennsylvania. And it's my pleasure to host this panel discussion today on a topic of great interest to Pennsylvanians. And that is the forthcoming resumption of scheduled surgeries and procedures at Pennsylvania hospitals across the whole Commonwealth. Now, why are we talking about this? Well, back in the middle of March, Governor Wolf issued an order to suspend all scheduled procedures and surgeries. The purpose of that order was to help prepare for an expected surge in COVID-19 patients. It was also designed to play a role in helping to reduce the risk of rapid spread of the coronavirus. Well, it's several weeks later now, and there's evidence that the incidence of new cases of COVID has begun flattening. And it has led to the Secretary of Health to issue new guidelines that will permit hospitals across Pennsylvania to begin resuming these scheduled surgeries and procedures. And making those decisions based on data that's available to the hospitals and health systems, and based on a determination by facility leaders that resuming these surgeries and procedures is safe, both for patients, their families, and of course, healthcare workers themselves. So, we are lucky to be joined in this panel discussion with two significant leaders in the hospital community. They include Dr. Ed Hartle, who is the Executive Vice President and Chief Medical Officer at Geisinger Health System, headquartered in Danville, Pennsylvania. We're also joined by Dr. Shelley Buck, who is the President of Mainline Health System's Riddle Hospital, which is just part of the Southeast Pennsylvania community. So we'll be getting back to them in a moment, but this is an opportunity for us to address concerns that Pennsylvanians might have about the safety of going back to hospitals and some of their facilities while we still do have COVID-19 cases still developing across Pennsylvania. And we'll want to address the steps hospitals are taking to make sure Pennsylvanians can, in fact, feel safe. So with that, I'd like to begin just by asking each of our distinguished healthcare leaders to begin with a couple of minutes about themselves, about their facility. And I thought I'd go ahead and start with Dr. Buck.
Hi, thank you, Andy, and good day to everyone. First, I'd like to say thank you, Andy, to you and to HAP for hosting this forum and giving us an opportunity to speak with our healthcare consumers about the critical work that we're doing to ensure that they are safe as we start to reopen again in our communities and in our state. I have been the president of Mainline Health Riddle Hospital for approaching almost a year now. It'll be a year in September. I come with over 30 years of experience in the healthcare area, working in the field of nursing as my foundational entry into healthcare, all the way up to my current position. And so it's just a joy to be here with a system that is progressive and that is just focused on safety and quality of care as they are here in Mainline Health. So I just want to tell you a little bit about what we're doing to prepare ourselves for bringing surgeries back into our system. We have here at Mainline Health been very focused on ensuring the safety of our staff, the safety of our healthcare team members, our physicians, nurses, and all of the team members that work in our areas, as well as the health and safety of our patients and the communities that we serve. That is definitely first and foremost. We've established a recovery team to start planning how we're going to begin bringing surgeries back into our facilities. We still have a good number of COVID admissions, and so we're looking at how we can begin to bring elective surgeries as well as the surgeries that will impact someone's well-being back online, so that patients can get the services that they've been waiting for because they have been postponed because of the COVID outbreak. We are ensuring that we have the appropriate level of personal protective equipment, or PPE as we call it, on site, as well as ensuring that we have enough, or I should say adequate supply of testing capabilities. We do believe that we need to proceed with optimistic caution as we prepare to reestablish, our surgeries and our procedures within our system. All it would take is one COVID positive patient to come in for a procedure and infect an entire team, and then that would ultimately impact so many others that would require the services of those team members and healthcare providers. So we want to be very careful as we restart all of our surgery procedures here at Mainline. We'll be ready to resume our elective procedures when we believe it's safe for our team and our community to do so. And so right now, like many others, we are tracking the number of admissions that are coming in, and we're seeing a bit of a flattening or a plateau, if you will, but we're looking for a decline, specifically a 14-day continuous decline before we feel as though we're ready to, flip the switch, to full light, if you will, and go back to as close to normal operations as we can assume. We anticipate the middle of May for the time period for when we believe that we'll see a steady decline, and we'll be able to move really a little faster in bringing surgery cases back into our facilities. We believe that we have sufficient testing capabilities now to be able to test patients that require emergent surgeries, perhaps cases that would require some surgeries because of the delay that the pandemic has presented for their cases. So they have become more urgent or emergent, if you will. So we can test these patients, that are coming in, as well as when we look at our tiered approach that we've put into place, the tiering being the emergent cases that cannot be delayed, then next being cases that provide better health and well-being for our patients, and then finally the purely elective cases. So we put this tiering process into place early on in the pandemic. And so when we go back to that tiering, process, we want to call the patients that have had to have their cases postponed, reevaluate, and then bring them in a phased approach, just as we tiered, the cases, we bring them back in a phased approach. So we have our surgical services team looking at that right now and planning how they'll re-engage, with patients to bring them in. But again, it's about safety and ensuring that patients are safe to come into the facilities. We want to ensure that patients are leaving our facilities, just as healthy, if not healthier, than they did when they came in through the door. And so we're ensuring that our staff have the personal protective equipment, our physicians, and so on. So that's critical for us right now. So again, we're optimistically pacing ourselves and being very mindful and thoughtful and pulling all of the data together to ensure that we do indeed see a steady decline, because the worst thing we believe that could happen would be a resurge of our COVID patients because we've relaxed too quickly, or we've not maintained social distancing and all of the protective and cautious behaviors that we've seen lately.
Right. Thank you, Dr. Buck. Now, you've just described steps you're taking in a suburban Philadelphia community. And let's turn now to Dr. Hartle. Geisinger's footprint extends all the way from a relatively more rural community in northern Pennsylvania all the way down into Harrisburg. Love to hear your thoughts, Dr. Hartle, on how Geisinger and your team are approaching this move to resumption of scheduled procedures.
Thank you, Andy, so much for having Dr. Buck and myself today to discuss this important topic. Getting back to life as we knew it before COVID disrupted our lives, our economies, and more isn't really a flip of the switch. It's more of a dimmer approach for us. As we see a phased reopening of our components of our society, it's more important than ever that we do so responsibly. This means in the early stages, life may look a little different. Lunch breaks may need to be staggered. Telework will continue to be encouraged. Spacing of at least 6 feet might become the new norm in public areas, and large gatherings may need to be limited to smaller crowds. As a healthcare system and for society at large, a return to normal needs to be driven by data and with the safety of our communities at the forefront. We cannot take the early signs of leveling off or flattening that we're starting to see and get complacent. We must remain diligent in our efforts to stop the spread of the virus through social distancing and other preventive measures. In the medical community, the first step to returning to normal is reinstating non-emergency, selective, and other preventive measures. Similarly, this must be done with care. We understand that many people may be living in discomfort, awaiting non-emergency or scheduled procedures. Ramping up to full operations with these surgeries and appointments is something that must be done gradually while considering several factors, most importantly of which is how COVID-19 is performing in our communities and the safety of our patients, our communities, and our staff. As Dr. Buck mentioned, some of the things we need to consider in determining a timeline for returning to elective procedures are whether we have the testing capacity to test everyone having surgery. We do within our system, but I know that there are many systems across the state that are struggling with that. Whether we have enough of a blood supply, we do again within our system. And in large part because of the turnout that we've had within our own employees to be able to donate that blood. Whether we can reassign staff that have been pulled from their traditional roles. And that's clearly going to be a consideration as we move forward. And also the capacity of our bed capacity, particularly ICU capacity, and whether certain procedures are going to require ICU stay after those scheduled or non-emergent procedures. These factors and more are all being considered as part of a comprehensive plan by us as we're building to gradually get us back to a place where we can start performing elective procedures. So Andy, that's where we're at this point in time. I just want to again thank you for the opportunity to be part of this panel.
Well, thank you, Dr. Hartle. And I'm looking forward to asking you each a couple of questions. But before I do, I just wanted to note a couple of themes I heard from both of you. One is this emphasis on safety, that you're not going into this resumption with your eyes closed. You're being very thoughtful, deliberate, and measured. You're keeping an eye on any number of data to inform your resumption decisions. I have to think that will be very reassuring to your patients to know how carefully you're moving forward. Let me ask this, and I'll start with Dr. Buck. I'm trying to imagine a patient thinking they've got, for example, you mentioned the idea that somebody might be in pain and they've deferred care and they want to come back, but they're probably thinking about steps you are taking specifically to protect me as a patient before I come to your hospital. Dr. Buck, you mentioned things like having plenty of personal protective equipment, but what other steps do you think would reassure me as a patient that I'm not going to get, even if I have no COVID-19 exposure previously? How can I feel better that when I come to your place, I'm not going to pick it up?
Well, thank you for that. I'm sure many people are concerned about that, knowing that a lot of COVID positive patients are coming to the hospital. I'm sure they're wondering, what happens to me when I walk through those doors? With the most recent, I should say recent being the last few years, emphasis on quality of care and, eliminating or decreasing harm and infections, within healthcare. Picking up an infection coming into the doors is probably top of mind for many people right now. We are ensuring that all of our staff are wearing masks. Of course, hand washing is key, not only in the hospital, but outside of the hospital. Making sure that, your hands are cleaned and that you have the appropriate gowns and cover, to wear to protect not only the healthcare worker, but also the patients that they're caring for and the spread and the transmission. One of the other things that we're doing is we are cohorting patients that are testing positive for COVID in one or multiple units, depending upon how many patients are coming in the door. And we do that simply to contain the spread, try to contain the spread as best as we can, to utilize negative pressure, and also to bring the experts, because as the staff, both physicians and nurses and our infectious disease, providers and practitioners are in one unit specifically, they can bring that expertise and sharpen their skills, and sharpen, their procedures in caring for patients that are indeed COVID positive. And so those are some of the measures that we're taking. We are screening people as they come in, those people being all healthcare workers as they come in to the building, monitoring for their temperatures, both while they're at home. We ask that staff monitor their temperature as well as before coming into the hospital. We continue to limit our visitation. We have restricted visitation. However, we do provide visitors and support persons for our OB patients, of course, laboring mothers, and patients that are experiencing end of life or hospice. We do provide support there, as well as our pediatric patients, allow for visitors, or a visitor to come in and accompany that patient. But other than that, we want to restrict our visitation and limit the access to the building so that we can try to manage the spread of the infection as best as possible.
So basically what patients can expect is that COVID patients are kept in, use the term cohorts, but they're kept in parts of the facility. And if I'm a non-COVID patient, I generally am going to be kept away from them and in a sort of a safe corridor of passage and treatment.
Yes, exactly.
Got it. Well, Dr. Hartle, I'm thinking about folks coming in for pretty serious inpatient surgery. They come in, they spend a couple of days, and then they're discharged back into the community. What does their follow-up care look like in this new COVID world? For coming, how will you get follow-up care after surgery differently than before COVID happened?
Sure. So Andy, we had put processes into place even prior to COVID, really to try to optimize care of patients outside of the hospital. A number of pieces were put into place prior to COVID. Those pieces really have only just been accelerated with the COVID process. For instance, our orthopedic patients that had surgery prior to COVID, a lot of their follow-up care was being done by telemedicine. Telemedicine not only to ensure their transition, but also to facilitate physical therapy, et cetera, in the home, and not having to come to a facility to be able to do that. We've expanded that telemedicine to multiple other programs, even before COVID, but as I said, much more accelerated afterwards. To Dr. Buck's point, if patients need to come into a facility to be seen, we're going through the same type of processes to be able to ensure their safety. We screen our patients and our staff coming in. We mask our patients and our staff that are present within our facilities, and be able to segregate out, so to speak. We practice the same social distancing that we would otherwise in the community within our clinics and our exam rooms, et cetera, as well. So all of those pieces really being put into place in order to enhance the care of the patient, but also to facilitate their safety. I think another key component of all this is really related to communication, Andy. We've gone through an extensive process in regards to communication, both for our employees and for our communities, including town halls that we're doing several times a week, whether it's for our employees, for our communities, and for our patients. And also providing that information in multiple different sources within the media, whether it's on our websites, whether it's in the social media, whether it's in the press, whether it's TV, et cetera, allowing individuals to understand the things that they need to do to be able to keep them safe. Realistically, I think our facilities, because of the way that we manage the process because of the PPE we use, because of the our environmental service personnel, et cetera, and the cleaning processes are probably one of the safest places that our patients actually could be in our communities.
Mm. That's a very reassuring statement for sure. You mentioned communications, Dr. Hartle. I'd like to ask each of you to talk a little bit about communications to communities that may not have all the access to technology, home computers, and even folks for whom English is a second language. Can you just address how you try to be in touch with folks that may not have home computers to be able to follow this and you take advantage of telehealth, for example? Dr. Buck, how do we deal with that?
Sure. Well, indeed, that's always challenging, especially in today's world where technology is at everyone's fingertips, but we know that that technology isn't truly at everyone's fingertips. And so a lot of, like what Dr. Hartle said, we too are having weekly town hall meetings and calls and with our staff, with our community members, our board members, with our physicians. And through that communication platform, we get the word out. We ask our staff and employees to be spokespersons and to help remind, their family members the importance of, staying at home and social distancing and washing their hands and wearing their masks and things like that, as well as, getting to the physician via telemedicine or urgent care or emergent care if needed, in the event that they feel as though they may need emergency services for strokes or heart attacks, or things like that, and not to delay that care. So a lot of it has been through word of mouth and, our social media platforms, of course, that we use, and our telemedicine services and staff continue to call, and our community outreach staff, I should say, continue to call, patients at home to check on them. We continue to have home health services and nurses and physical therapists that go out to the home and provide services, to the people that need them. And so through those platforms and I think venues, we're trying to get out to the community to let them know that, hey, we're still here. Come and get care. The services the doors are open, especially when you need it. The last thing we'd want to see is for folks to, delay any care because of their fear of COVID. So.
Thank you. That's the idea of delaying needed care, even essential care. It may not be emergency need, but profound needs such as chemotherapy and other cancer treatments that could theoretically be delayed. There's still potential harm, which is why you all are eager to get started safely because of all this pent-up demand for essential health care. I mentioned this idea of deferred care. It's been going on for many weeks. I think what I'm hearing from both of you is that we're not going to return to normal in the middle of the next month. It can take months to ratchet up, both because of the uncertain progression of the disease, but also this idea that patients are still going to be afraid. And I'm hearing you both talk about strategies you're pursuing to reassure consumers that if you're inviting them to come in, you're attesting to the fact that you're ready, that you have all the safety procedures in place. Final issue that I wanted to ask you all about, you each mentioned your testing. I think in the national news media, there's a great deal of discussion about limited testing capacity. Now, each of you have good, strong testing resources at play. Isn't it possible, though, if you don't have the perfect supply of testing, that there's still measures that some hospitals could take that even absent perfect testing, in light of the need for some of these procedures to happen, that there are ways that you can still operate safely? Can you talk about that a little bit, Dr. Hartle?
Sure, Andy. I think two things. First of all, in regards to the testing, even if you tested somebody prior to a surgery, and again, it's looking at the turnaround time that happens with that. it doesn't necessarily mean a negative test that that individual doesn't have COVID. And I guess one of the concerns, even if you had the ability, as we do, to be able to do that testing, do you, by virtue of a negative test, give a false sense of security to your staff, et cetera, that the patient doesn't have COVID? So I think it really goes back to the issue of doing the things that we all know are important to start with. That is to screen patients for symptoms, to give an indication of whether or not they potentially have COVID, and to utilize your PPE, your personal protective equipment, appropriately in order to protect yourself as well as your fellow staff members and other patients. So having testing is great. We do have the capacity to do that. We have the capacity to test patients coming in prior to surgery, but it isn't necessarily the necessary element with this. I think the most important element is basically that people utilize their protective equipment and they screen individuals and they practice conservatively the way that they should, and utilizing all the other factors that Dr. Buck and I've mentioned before that, and that is the social distancing, the hand washing, the universal precautions, all the things that they would use whether it was COVID or not COVID being present.
Well, thank you for that. Well, let me wrap up then. I first of all want to thank Dr. Hartle and Dr. Buck for your thoughtful comments today and for taking the time from incredibly crushing schedules to join us today. I think a couple of takeaways that I'm hearing are, number one, we used to talk a lot about all the preparations that you were taking to handle the surge of patients. I'm impressed by the level of effort going into all the preparations necessary to resume full operation, particularly around scheduled procedures. The degree of care and attention to details on personal protective equipment, testing capacity, staffing readiness, facility readiness really is reassuring. I also heard the importance of keeping an eye on the data, and that you're not going to be ratcheting up either through a tiered process or basically a tiered or phase-in process. You're going to be following data very closely as you do so. I'm also reassured that you are taking steps to assure non-COVID patients that as they come into the facility, many safeguards are in place to protect them from infection. So that leads me just to, for any Pennsylvanians that happen to be watching this, to take a measure of confidence in the fact that hospitals, when they say they're ready, they are ready for you. And we don't want Pennsylvanians to put off needed care any longer than is necessary. And it's because these measures that hospitals are taking are making them safe for you to go back and get this essential care. Now, finally, as you think about going back to a hospital, call your physician, call your nurse practitioner, call your provider, and have a conversation. Is now the time to come back to get your deferred procedure? And jointly with your provider, you'll make the right decision, and you and your family can be confident that getting that care is important, necessary, and safe. So with that, thank you for listening. And again, my thanks to Dr. Hartle and Dr. Buck for your time, and wish everyone a very safe period of time as we go forward with COVID-19. Thanks very much for joining us today.